So a bit of a potted history, so this video makes some sense. Before we had our son Noah, who's now 2, I had 2 missed miscarriages, and that is when your body doesn't know that it's miscarried, so there's no signs. So I didn't find out I'd lost the baby until a 12-week scan, and then the second one was like a 7-8-week scan. So after the first miscarriage, it was just assumed that was just one of those things. And then, but luckily I found a consultant who looked after me, a private consultant. And it's a very, very long story, but essentially after my second loss, he said to me, I don't see any reason why you've lost this baby, so I'm going to do some tests. So the baby went off for genetic testing at Guy's Hospital in London. That came back completely clear, and it was a baby girl. And I had every blood test under the sun, and they all came back clear as well. So I went to see my consultant. He said there's only literally one thing left that I can think of, and that is something called elevated killer cells, elevated natural killer cells, which I had read about on the internet. Now, it's one of those areas where the NHS, there hasn't been enough studies and things, so it's not actually a recognised thing on the NHS yet, although a lot of fertility specialists and gynecologists and things are a firm believer that this is a cause of miscarriage in women. So my consultant sent me off for a private blood test at a hospital in Surrey, and that cost I think about £600, but I got the results the next day. And essentially, yes, I had elevated natural killer cells. They like your levels to be well under 10%. Mine were about 13%. So from my very limited knowledge, I'm in no way a medical expert, but the way I see it is when you have elevated natural killer cells, we have them in our body anyway to fight germs. We need them, they're great things. But if you have too many and you become pregnant, your body sees the pregnancy as something threatening or bad, and it attacks until the baby dies. So with my pregnancy with Noah, I was put on a big combination of drugs, and something worked because 9 months later I had a healthy baby boy, and he's the light of our lives. So I spoke to my consultant back in November and said, oh, hi, we're thinking about trying for another baby. What should I do next time? He said, just come and see me as soon as you've got a positive, the earlier the better, because the natural killer cells, they start attacking straight away. He said the earlier the better, come and see me and we'll just get you back on the same course of drugs that we did last time. So I found out that I was pregnant, I know this is crazy, 8 or 9 days before my period was due. I was getting positives on the first response tests. So I made an appointment and went and saw him, and he was like, oh, so you're trying for a baby? I was like, no, I'm pregnant. I'm here, I'm pregnant. He was like, right, brilliant. So we started on the same course of treatment that I had with Noah. So the drugs that I am taking are, sorry, I'm really out of breath. It's a pregnancy thing. The most important one, so I've been on these, I'm now coming up to 13 weeks. I've been on all of these since before 4 weeks, so a long time. The most important one is my steroids. So these are called prednisolone, which I think is a really common steroid. It's used for things like asthma, I believe, Crohn's disease. Sorry if I've got that wrong. I think that's right. They're 5 milligrams. I have to take 4 a day, so 20 milligrams a day. And I will be taking these up until, well, after we've had our 12-week scan, which is next week. Hopefully all will be well. But then you actually have to wean off them because they're so strong. So you can't just stop. So my consultant will give me a plan. I think it takes about 3 weeks to come off them. These are strong drugs, and they come with a lot of side effects. When I first started taking them, I felt terrible, probably for about 2 weeks. So the main side effects of these are increased appetite, which is not great when you're pregnant anyway and starving. So you have to kind of almost watch yourself with weight gain a little bit. My favourite side effect on the leaflet is a fuller, rounder face. You may have noticed I do have a fuller, rounder face. I don't think it's gone too bad because I'm not on a really high dose, but I've definitely noticed that's probably because I'm eating so much. The other side effects I get from these are stiff joints and knee pain. I had this with Noah. I don't know if it's a thing. I think it is. I think I've read it in the leaflet. I suffer with bad knees anyway. On these, it's like 1,000 times worse. So trying to do gentle exercise in early pregnancy for me is really hard. Even walking the dog, I'm then kind of literally hobbling back like an old lady. I feel like I've got arthritis, so that's not nice. But again, for me, it's a necessary evil. The other things they cause, they can give you stomach acid and an upset stomach. I was actually prescribed like an antacid thing to combat that, but I haven't managed to take those because logistics of having to when you take them in the day, it just didn't work out. They also cause me to be quite manic. In terms of not being able to sleep. The insomnia is crazy. It has settled down a bit because I've got used to it, I think. But I haven't been sleeping very well. So that combined with getting up for a wee in the night because I'm pregnant, really haven't had much sleep. But again, it's one of those things. Other side effects, they give me a really, really dry mouth and throat all the time. So I feel like I need to drink all the time, but drink doesn't actually cure it or kind of quench that sort of need. I don't know what it is. So I actually carry around some like sugar-free sweets from Marks and Spencer's. So top tip if you're on these, and it kind of just helps. The next thing I'm on is our blood thinner injections. These are Clexane, 40 milligrams. I think Heparin is another one that people take. So these are a daily injection. They come in a little packet. The reason I believe that I have these is I don't suffer from blood clots or a sticky blood disorder. I have been tested for that, but elevated natural killer cells can cause your blood to be a bit sticky. It's like a side effect, which in turn can kill the pregnancy, obviously. So yeah, I'm on these again until probably about 13 weeks. I make my husband Jay do the injections, and my stomach looks like a bruised pincushion, and they are really painful, but it doesn't last that long. Top tip if you have to have injections in your pregnancy, find the sort of fattest part of yourself, mine is my stomach, and ice the area for 10 whole minutes before you do the injection. It really, really helps. Next up, these are not fun at all. These are my Cyclogest pessaries. Now, I'm not going to explain what a pessary is to you because I'm sure you'll know. We often use them for thrush and things like that. These are 400 milligrams, and these are progesterone. And I believe that progesterone just helps support a healthy womb lining. So I think it's just like an extra safety net, but I will take do whatever my consultant says. So I was initially on 2 of these a day. One in the morning and one overnight, but they were causing me so much grief. I was in pain and so irritated that I spoke to my consultant, and he said, oh no, you can go down to 1 a day. So I'm now just on 1 a day, and I pop it in before I go to bed so it doesn't irritate me too much. So they're just little pellets, if you like, pessaries, and they're messy. They're really messy, and they're not fun. But again, if it's going to help keep my baby safe, literally, I don't care. So the next treatment I've been having, and I had with Noah, it's a weird one. When I tell people about this, they're like, what? So I had it with Noah 3 times. I've only had it twice this time. I don't think I'm having any more. My consultant says it's fine. It's called a Sawyer Intra Lipid. So it's this weird treatment. It's a bag of white fluid, which is essentially egg and soya, like an emulsion, mixed together. It's injected straight into your veins. It takes about an hour and a half, and apparently it coats the killer cells and stops them from attacking the baby. It's crazy. And I have them, you have to have it done privately. I have them done at a clinic up near Harley Street. It's about £140 per bag, per treatment. So I had one at 4 weeks, and then I had one at 8 weeks, I think. Yeah, so here's what happens when I go up to Harley Street. I'm just about to go for my first infusion, my Sawyer infusion. I'm quite nervous about the whole thing. I don't know why, because I had them with Noah, but I guess it's just the anxiety kicking back in, and I'm about 25 minutes early, but I'm just going to go in now and Hopefully it won't take too long. It's all coming back to me. And the last thing that I've been taking every day since before 4 weeks for my pregnancy is good old aspirin. If you've suffered any kind of pregnancy loss or infertility, you'll know about aspirin. It's supposed to be a wonder thing for keeping pregnancies. Again, I think it's to do with blood thinning. I take 75 milligrams a day. And the dispersible one, so the soluble one, my consultant said it gets into your bloodstream a lot better or something if it's soluble. It's not that nice. I mix it with a really little bit of water, dissolve it, down it, and then have some juice or something nice to drink afterwards to take away. It's a bit of a sort of a sicky taste. But these little things, again, it's just, for me, part of what is helping me stay pregnant. That is everything I think that I've been on in this pregnancy. I would do it all again in a heartbeat, absolutely. So if you've got any questions, because I know it's a really sensitive subject and it's a bit of a minefield, and I only learnt about this from watching videos or reading blogs and things and scouring the internet. So leave me questions below. I will answer them as best I can, I promise you. And if you're going through difficulties, just hang in there. It will happen, and I know what you're going through. But thank you so much for watching. Don't forget to subscribe if you've just stumbled across this channel. I'll be doing loads more updates on my pregnancy, and I will speak to you again very soon. Bye.